Blood pressure. Blood pressure is a measurement of the force exerted by blood against the walls of the arteries at the heart pump it throughout the body. It is typically expressed as two numbers, such as 122 over 80 mm of mercury and is measured in millimeter of mercury. The first number, called the systolic pressure, represents the pressure in the arteries when the heart beats and pumps blood. The second number, called the diastolic pressure, represents the number in the arteries when the heart is at rest between beats. Here is a general guideline for interpreting blood pressure reading in adults. Normal blood pressure less than 120 over 80 mmHg. Elevated blood pressure 120 to 129 over 80 mmHg. Hypertension stage 1 130 to 139 over 80 to 89 mmHg. Hypertension stage 2 140 or higher over 90 or higher mmHg. Hypertensive crisis higher than 180 over higher than 120 mmHg. Primary hypertension. This is the most common types and tend to develop gradually over time with no identifiable cause. Multiple factors including genetics, age, lifestyle choices, and certain underlying conditions can contribute the primary hypertension. Secondary hypertension. This type of high blood pressure is caused by an underlying medical condition or medication. It is usually appears suddenly and causes higher blood pressure level than primary hypertension. Conditions such as kidney problem, hormonal disorder, thyroid issue, and certain medication can lead to secondary hypertension. On the other hand, low blood pressure, known as hypotension, occurs when the force of blood against the artery wall is lower than normal. While low blood pressure is generally not as concerning as high blood pressure, excessively low level can cause symptoms and complications. Some common causes of low blood pressure include dehydration. Inadequate fluid intake can result in low blood volume and subsequently low blood pressure. Medication. Certain medications, such as those used to treat high blood pressure, diuretics, or certain antidepressants, can cause a drop in blood pressure. Heart problems. Issues with heart function, such as heart valve problem, heart failure, or a heart attack, can lead to low blood pressure. Endocrine problems. Disorders like adrenal insufficiency, hypothyroidism, or diabetes can contribute to low blood pressure. Severe infections or allergic reactions, conditions that cause a systemic response such as sepsis or anaphylaxis, can result in low blood pressure.